So Petros came here about a week ago,
Yes.
right? Acute lower back pain. Tell me about the pain and how it started.
It started 5 days before I came here for the first time. It getting worse and worse. I can bend it. I can step, walk in steps. A lot of pain, like from 1 to 10, like a 9.
Okay. His pain scale was about a 9 then. So it's after his third visit today, and what's your pain scale today? He's about a level 3 of pain. Before he was a 9. He just finished his third decompression visit today. So after examining him on his first visit, we sent him for an MRI, and we found out that he had a disc protrusion at L5, S1 at his lowest disc that was putting pressure on some of the nerves in his lower back. We recommended a course of treatment with spinal decompression and some other therapies as well. And he seems to be doing very well.
Yes.
So initially his range of motion and his lumbar spine was very, very limited. He couldn't even go about 5 degrees in flexion and extension. And I just want to show you where he's bending now. Let's face it that way, Petros. Let's bend forward as far as you can. So he's bending about 85 degrees, almost 90 degrees in flexion. He was, when he originally came, he couldn't bend about 5 degrees. This was only 3 visits ago. Now let's bend backwards. And so that's about 15 or 20 degrees, which is almost normal actually. That's good. He's doing really well. He's got a ways to go with the therapy and everything, but he's being very compliant. He's listening. He's wearing a belt at work. So I think he's going to do wonderful.
Thank you.
I'm here with my friend Petros. He's been under treatment for several weeks now. He came in with acute lower back pain. Your pain was what when you originally came?
Like a 9, 10.
9 or 10. Today, what is the pain?
It's like no either one.
0 or 1.
Yeah.
Pain almost all gone today.
Almost.
Maybe a 1 on the pain scale,
Yeah.
approximately. So we've been doing spinal decompression with him. We've been doing spinal rehab with him. We've been doing chiropractic with him. We're going to check his range of motion now, and we're going to start to add some strength training for his lower back, as well as flexibility and strength of his core. Let's bend forward as far as you can. Okay, don't bounce, just go down, drop your head. So he's about 85 degrees in flexion. Let's bend backwards. So this is much better than it used to be. So he's going about 30, 35 degrees in extension. Let's bend over to the right side. This is about 30, 35 degrees. Let's go to the left. And that's about the same, 30, 35 degrees. Let's cross your arms at your shoulders. Go like this. This is called a Kemp's test, which checks for an acute lumbar disc herniation. When we did this test to him initially, it was very painful. I'm going to turn you back. Does this hurt at all?
No.
So Kemp's test on both sides is now negative. That's a very big indicator of how the disc itself is doing. It helps differentiate just stiff muscles from disc irritation or damage. Now Darwin, come on in. This is Darwin. He's our assistant. He's going to help give Petros the weight. And we're going to do some what we call goblet squats. Okay, so you're going to keep your back straight. Let's go down. Let's do 5. Nice and slow. 1, 2. Nice and deep. 4, 5. Okay, let me have that weight. Hold this. Stay there. Cross your arms again. I'm going to recheck this. Okay, take a few steps around, see how you feel.
Very good.
Okay, good. So we're probably about 80% of the way there to getting him completely well. So most of the pain is gone now. Now we're working on the rehab end to strengthen him up so the problem doesn't reoccur later on. Very good.
Thank
All
you.
right, good.